Going to detox for the first time for many people is a scary experience, and I would like to talk about what you do before you get here, what you do when you get here, and what happens while you're here. And the very first thing that would happen is that someone would call us, and we would engage what we call the pre-screening process. And that means that over the phone, information will be gathered to establish appropriate admission criteria, to gather a brief medical history, a brief pattern and amount and route of administration for whatever substance that person is using, or if it's alcohol, the amount of alcohol, last drink, how long they've been drinking. All of this goes into a pre-screen assessment that is then passed to our admission nurse to review. And at that point, then they're scheduled for detox, either the same day, next day. It just depends on space availability. You're given a time to show up. At that point, I would and we here would really appreciate it if you could show up as close to that time as you can. After you get here, an intake process will occur where the person will their vitals will be taken. They will meet with a nurse, and the intake person will ask them some questions to fill out the demographics in their admission packet. Their medical history will be reviewed with them by the nurse. Their vitals will be taken. A UA will be requested at that point to make sure that we don't have substances on board that we can't manage here. At that point, then, that person will be assigned a counselor. They will receive a treatment plan. They will be walked from the admission area down a narrow hallway to the detox program, where they'll be introduced to the care nurse. And this will be the nurse that will be responsible for their care, to do medical assessments on while they're here, and just to make sure that their withdrawal is managed according to the protocol they're admitted through. So that person then would come in. They would be given an orientation tour by the aide, introduced to as many staff members as were present at that time. They would be oriented to the board that shows them who's on duty, what their role is, and what they need to be doing next. They'll be shown their bed area. They'll be, at this point, already wearing the required blue scrubs or pajamas, as they're called. This is a safety precaution so that the patients look markedly different from the staff. So they've been introduced to their counselor. They've been given an orientation. They've been, told about meal times. They've been had an informed consent, if you will, in regards to their agreement to participate, their consent for treatment with us. And sometime on day 2, that would be the next day, they'll meet with a counselor at that point, go over that treatment plan, sign it if they haven't already signed it. They will then engage in the assessment process, which is to take and gather a complete history of all medical issues, legal issues, education, alcohol and drug use history, patterns of use, methods of use, everything we need to know up to last use, so that we can get a picture of the progression and tolerance that has occurred in a person's life that led up to them arriving here in Buckley. The assessment will have an outcome that will assign a level of care most recommended for this person's situation according to the assessment. At that point, then, if that person is going to stay here in this community, say they're from Eugene, we would refer appropriately to one of our programs. If we had an opening in residential, at that point, we would coordinate to transfer them to residential. If we did not, we would put them on a waiting list, and then we would refer them to our Rapid Access Center for engagement in our intensive outpatient program. We would do a direct transition. The paperwork would be completed here, and that person would be able to arrive at the downtown outpatient building with very little paperwork left to do, and a smooth transition into attending their first group either that night or the next day, depending on what day of the week it is. Buckley operates 7 days a week. Discharge planning occurs the minute the person gets here. and is much easier to accomplish Monday through Friday, but doesn't mean that Saturday and Sunday are not accomplishable goal days. Sometimes if a person is scheduled to leave on Monday, we will be working on the discharge plan on Sunday the best that we can. And then we also help in aiding with transportation if the person is an out-of-county resident and they desire to return to their county of residence, then we will effect a referral to the correct level of care in the county they're from. That's pretty much describes what happens here. 24-hour monitoring occurs. The care nurse is going to be doing assessments every 4 to 6 hours to assure the level of the person's withdrawal matches the medication protocol they're receiving. And so everybody's closely observed, kept safe, kept as comfortable as possible, in a comfortable, warm, dry environment where they're fed meals that are prepared on site. We go with a lot of fresh vegetables and fresh meat products here that are low in the sodium, looking to feed people as healthy as we can. Thank you. I hope this video has helped to answer some of the questions that people often ask after they get here about what happens here, what happens after they leave here.